The topic is solitary non-toxic thyroid nodule, which means solitary means single, non-toxic means the thyroid hormone level in their body is normal and there's a nodule sitting in the thyroid gland. Most of the time what happens is the patient, for some reason related to the neck, he happens to go to a physician and the physician will order for an ultrasound neck. And there, in addition to that particular complaint, they notice a thyroid nodule. So this is an incidental finding. Since they have taken an ultrasound, they have come to know there is a nodule. So with this report, they may be referred to a surgeon or to a ENT specialist. So what is the importance of this single nodule which is seen in the thyroid gland? Now, see, if in a general population, if you see, 7% of the population, they have this nodule. And since they have not undergone any test, they have no idea about this. It is there in the thyroid gland and it goes unnoticed and without any treatment, without any problem. And usually this thyroid problem is seen between the age group of 30 and 50 and more so in females. Now, coming to this topic, solitary non-toxic thyroid nodule. So any nodule, it can be benign or malignant. And when the patient comes to us, the main fear what they have is, and the first question is, doctor, is this cancer? What I have to do for this? Can you tell me more about this? So to start with, the nodule, either it can be benign or it can be malignancy. Benign means it's a non-malignant condition and there's a possibility that it can turn into malignant. What is the possibility? To start with, it is 3 to 5%. So if you put in the other way around, 95 to 97%, it is normal. It's an incidental finding alone. But we have to rule out whether it is malignancy or not. So under the topic of benign, we have so many different diseases, conditions. And under the topic of malignancy related to thyroid, you have so many different type of malignancies. So if you want to know about each, you can go into YouTube and just enter Dr. Zakir Hussain ENT and whichever topic you want. So I am not going into the details of that. Here I just concentrate on a single nodule which is non-toxic and how we have to diagnose and we have to rule out it is not malignancy and how we are going to deal with it. Now, to come to know whether it is malignancy or not, we have to ask so many different questions and we need a history from the patient. And we need to examine the patient and we have to do the few tests. Let us go through one by one. In the history, suppose the first grade or second grade relative, any one of them, there is a history of thyroid malignancy, then there is a possibility that this also may turn malignant. As I have mentioned before, it's usually these thyroid problems are seen between the age group of 30 and 50. Suppose the patient is below the age of 20 and above the age of 60, then the possibility of it being malignant is more. As I mentioned before, thyroid conditions generally it is seen in females. When a male gender is affected with a thyroid problem and he has got a thyroid nodule, there is a possibility that it can turn malignant. And one more important point to add up, if there is a past history of multiple X-rays being taken, multiple CT scans being done, that also can aggravate a benign condition to turn into a malignant condition. Now coming to the patient complaint, he may say that the thyroid, the neck part, the swelling is increasing in size, and associated with that, he has got change of voice, which is not reverting back to normal. There is cough, which is irritating him a lot and is not getting relief with medication. And he is not able to eat normally. he gets a feeling it's getting stuck somewhere here, and last he develops breathing difficulty. That means stage by stage his is getting converted and it's getting changed into malignancy and it is progressing. When you do an ultrasound, we get an idea whether it is benign or malignant. Here I have written down at least 9 important findings related to whether it is malignancy or not. To make it simple, when you get an ultrasound neck done, you see the impression, the last line, there will be impression in which they have graded their findings. There, if you see it's 1 means it is normal, 6 means it is malignancy. From 3, the percentage increases. Suppose it is 3, there's a 3 to 5% chance that it can turn into malignancy. And as and when the number goes up, the percentage of it being malignant turning into malignant increases. 6 being 4, sure it is malignant. This is about the ultrasound finding. So if you have done an ultrasound, just go through it and just go through the impression, check the number of what it is. Now, let me tell you the investigations in brief, what all investigations need to be done. To start with, we will do thyroid function test, which includes T3, T4 and TSH, which in most of the cases is going to be normal. Or it can be hypothyroidism, means the thyroid hormone levels is going to be less. Now, the next important test is ultrasound, which we have already done and we have gone through. When the ultrasound shows that there are features of malignancy, in which 9 points which I have shown you, and at least 1 or 2 are there, and the nodule happens to be more than 5 millimeter, the size of the nodule, we'll ask for a fine needle aspiration, the test. You put a small needle into the nodule, take out the cells and send it for testing. So the ultrasound which was done, it's an outpatient procedure, no need for admission. It is done within 5 or 10 minutes and the report is given the very same day. And for this fine needle aspiration also, you don't need any preparation. The patient goes in to see the doctor. The same doctor who has done ultrasound for you, he will do the ultrasound first, and ultrasound guided is small. He'll put in a small needle and he will not give any local anesthesia. It is not going to be painful. That's why he doesn't want to give a local anesthesia also. And there is no preparation, no cannula, nothing. There is no need of admission also. And immediately you can walk out of the room. You get the report within 3 to 4 days. That report is going to be something like this. Again, it is graded into 1 to 6. 1 means normal. I'm trying to tell you in a brief way so that you can understand. 1 is normal, 6 is malignancy. Most of the patients, they come under the category of 3. So they are worried. It is not normal, it is not malignant, and the possibility of malignancy is 3 to 5. 4 means the chances of malignancy, there's more chance of malignancy, more chances of it being malignant than being normal. So you have to see the FNAC grading number. So now we need more blood tests. We need thyroid, other than the thyroid function test, we need to do thyroglobulin, TPO antibodies and calcitonin if necessary. When the grading in both ultrasound as well as in fine needle aspiration, the grading is more than 4 and we have planned for surgery, we would like to do an MRI also. The MRI, if you ask me if it is MRI is better or CT scan better, I'll prefer an MRI and I'll tell you what is the need for an MRI. See, along with the thyroid gland enlargement and the presence of nodule, you may find associated lymph nodes, small swellings, which is mainly seen in this site. So we would like to know how many of that number is there and how big it is and whether it is related to malignancy or not. And when the ultrasound or FNAC is 5 or 6, or if it is 6 especially, we would like to do a PET scan too, positron emission tomography. How does it help? When the PET scan is done, it gives as an idea other than the primary whether it has spread in any part of the body, different parts of the, whether it has metastasized from that primary site or not. That is the idea of getting a PET scan done. See, I have briefed about what all things to be done. That doesn't mean that you have to get everything done. Your surgeon will decide you're in which grade. They will guide you which test to be done. It's not necessary everything to be done. Now, investigation part is over. The last one about treatment. So we'll deal in two sessions. Like one is benign condition, another one is malignant. To make you understand better, this benign condition, let me split up into three types. The first one being, it is diagnosed as benign, say 3 or less than 3, and thyroid function test is normal and there are no complaints on the patient side. In that case, just observation, and every 6 months they get an ultrasound done. The next variety, where already diagnosed as benign, less than 3, 3 and less than 3, and the patient, when the TSH is more, means the thyroid level in the body is less. So we have to replace the thyroid hormone and keep on following the patient. The last one, where it is diagnosed as benign. So benign, when I say, I am talking mainly about less than 3 and less than 3. There are some surgeons where even 3 they would like to operate. Why? There is a small chance of 3 to 5% chance of it turning into malignant. Now, the last category, where it is diagnosed as benign, but the TSH is normal, thyroid function test is normal, but patient has got complaints. Like the size of the swelling is increasing, and along with that, he has got breathing difficulty, not able to eat properly, change of voice, so and so. In that case, it is not medical management. We need to operate on the patient. So when the thyroidectomy is done, depending upon the type of thyroidectomy, if it is total thyroidectomy, we have to replace with thyroid hormones also. That's all about benign condition. If it happens to be malignant, we have to do surgery. There is no other way. Surgery, complete removal of the gland, supplement, and before supplementing the thyroid hormone, we would like to be sure that the whole of the gland is removed. How to make it sure? We can do scintigraphy, either iodine or technetium. When that is done, when we come to know there's a part of thyroid gland is left behind, we can ablate it or burn it off with the help of radio ablation. That brings us an end of this topic. So to brief, you have a thyroid nodule. We want to know whether it is malignant or benign or malignant. Get an ultrasound done. We have a grading. Reconfirm with a fine needle aspiration. Again, we have a grading. Less than 3, medical management. 3 and maybe 3 and more than 3 is a surgical management. And whatever is left behind of thyroid tissue, it has to be removed completely. Followed by radio ablation. Radio ablation is mainly for the differentiated type. So that's how we manage a case of solitary non-toxic thyroid nodule. Thank you so much.